If you masturbate every single day, what is physically happening to the walnut-sized gland sitting inside your pelvis right now? Is it being overworked, or is it being cleaned? There is perhaps no topic in men's health more polarized than this. On one side of the internet, you have communities warning you that daily frequency drains your nutrients, tanks your testosterone, and leaves you physically depleted. On the other side, you have medical headlines telling you that using it is the only way to avoid losing it. But when we stop looking at opinions and start looking at actual urological data, the reality is much more complex and much more interesting. We aren't here to judge your habits. We are here to look at the biology. Today, we are going to analyze the actual physiological changes that occur in the prostate gland when the ejaculation frequency is high. We are going to break down a massive study from Harvard University that pinpointed a specific magic number regarding monthly frequency. We will explore the concept of prostatic stagnation, investigate if you are depleting your zinc levels, and finally answer the question, does doing it every day protect you from cancer, or are you unknowingly causing inflammation? Here is what the science actually says about your prostate and your daily habits. To truly understand the impact of daily masturbation, we first need to strip away the myths and look at the plumbing. What is the prostate actually doing during this process? Many men mistakenly view the prostate as just a passive lump of tissue that sits there waiting to cause problems later in life. But biologically, it is an incredibly active chemical factory. Its primary job is to produce seminal fluid, that milky liquid that nourishes and transports sperm. Here is the crucial distinction. Sperm is produced in the testicles, but the majority of the fluid volume in an ejaculation comes from the prostate and the seminal vesicles. This fluid is rich in zinc, citrate, and specific enzymes like PSA, prostate-specific antigen. When you engage in sexual activity, the prostate creates this fluid. When you reach climax, the smooth muscles of the prostate contract forcefully to push this fluid into the urethra. This is the expulsion phase. So, if you are masturbating every day, you are effectively putting this gland through a daily workout cycle of production and expulsion. Urologists often refer to this as prostatic fluid turnover. Think of the prostate less like a storage tank and more like a sponge. If a wet sponge sits on a counter for weeks without being squeezed, the water inside becomes stagnant. It accumulates debris. However, if you squeeze that sponge out regularly and allow it to absorb fresh water, the internal environment remains cleaner. When you masturbate daily, you are forcing a high rate of turnover. You are constantly emptying the glandular ducts and forcing the body to synthesize new, fresh fluid. The question remains, is this constant high-speed turnover wearing the machinery down, or is it keeping the pipes clean? This brings us to the most significant piece of evidence we have on this subject. If you are worried that daily masturbation is harmful, you need to look at the data coming out of the Harvard T.H. Chan School of Public Health. For years, the medical community was divided. Some early studies actually suggested that high sexual activity might increase the risk of cancer due to higher testosterone levels. But Harvard decided to settle this with a massive dataset known as the Health Professionals Follow-Up Study. This wasn't a small survey of 50 people. Researchers followed nearly 32,000 men over the course of 18 years. They tracked their ejaculation frequency at different stages of life, in their 20s, in their 40s, and in the year prior to the questionnaire. Here is what they found, and this is where that magic number comes into play. The researchers compared men who ejaculated 4 to 7 times per month against men who ejaculated at least 21 times per month. If you do the math, 21 times a month is roughly 5 times a week, very close to a daily habit. The results showed a statistically significant trend. Men in the high-frequency group, those hitting that 21 times mark, were approximately 20% less likely to develop prostate cancer compared to those in the low-frequency group. This reduction in risk was consistent across different age groups. Whether the men established this habit in their 20s or maintained it in their 40s, the protective benefits seem to hold. Now, before you take this as a prescription, we have to apply some scientific scrutiny. A urologist looking at this data will point out the difference between correlation and causation. We have to ask, is the act of masturbation itself preventing cancer, or are healthy men just masturbating more? This is known as the healthy user bias. It is entirely possible that men who are capable of ejaculating 21 times a month simply have better cardiovascular health, better blood flow, and lower levels of obesity than men who only do it 4 times a month. If you are chronically ill, highly stressed, or suffering from poor diet, your libido and physical ability to perform likely drop. In this view, high frequency is just a sign of a healthy body, not the cause of it. However, even when the Harvard researchers adjusted the data to account for factors like diet, lifestyle, and medical history, the benefit remained. The connection didn't disappear. This strongly suggests that there is a biological mechanism directly linking the frequency of expulsion to the cellular health of the prostate gland. It suggests that the daily habit isn't just a byproduct of health, but potentially a contributor to it. So, why would emptying the tank protect the machinery? To answer this, we have to look at the prostate stagnation hypothesis. This is currently the leading biological theory explaining why frequent ejaculation, daily or near daily, might lower cancer risks. The premise is simple. Accumulation leads to inflammation. The prostate gland accumulates high concentrations of various substances from your bloodstream. While it concentrates beneficial things like zinc, it can also inadvertently concentrate chemical carcinogens found in your diet, environment, or even cigarette smoke. If you are not ejaculating regularly, these fluids sit within the prostatic ducts for longer periods. The stagnation hypothesis suggests that the longer these potential carcinogens remain in contact with the lining of the prostate cells, the higher the chance they have to damage the DNA of those cells. DNA damage is the first step toward cancerous mutations. By masturbating daily, you are effectively engaging in a mechanical flush. You are rinsing the ducts. You are reducing the contact time between the luminal cells and any toxic agents floating in that fluid. But it is not just about toxins. It is also about calcification. Inside the prostate, urologists often find small stones or calcifications, known as corpora amylacea. These are essentially tiny crystals that form when proteins and minerals in the prostatic fluid precipitate out of the solution, similar to how kidney stones form, but on a microscopic level. If the fluid sits stagnant, these crystals have more time to form and grow. While these stones aren't cancer, they are foreign bodies. They irritate the tissue. They cause chronic, low-grade inflammation. And in the world of oncology, chronic inflammation is a well-known driver of cancer development. When you analyze the tissue of men with healthy prostates versus those with issues, we often see that frequent ejaculation prevents these secretions from thickening and crystallizing. Furthermore, there is the factor of oxidative stress. As the fluids in the prostate age, they can generate free radicals, unstable molecules that damage cellular structures. Fresh fluid has potent antioxidant properties, but old fluid loses this protective capacity. So, biologically speaking, the use it or lose it mantra applies here. By inducing this daily turnover, you are constantly replacing old, potentially oxidizing fluid with fresh, antioxidant-rich fluid. You are keeping the ducts patent or open and preventing the stasis that leads to cellular irritation. However, biology is rarely black and white. While the Harvard data suggests a protective benefit, urologists frequently treat patients suffering from the consequences of overindulgence. Is it possible to masturbate too much? Yes, and the symptoms often mimic the very problems you are trying to avoid. If you are masturbating daily, particularly if you are engaging in long sessions or edging, the practice of prolonging sexual arousal without reaching climax, you are placing significant demand on your pelvic floor muscles. Ejaculation is a muscular event. It requires the rapid, forceful contraction of the bulbocavernosus and ischiocavernosus muscles, along with the prostate itself. If you are activating these muscles every single day, or keeping them in a state of high tension for hours while viewing content, they can become hypertonic. This means the muscles effectively forget how to relax. They enter a state of chronic spasm. This condition is often called CPS or chronic pelvic pain syndrome. Men with CPS often rush to the urologist convinced they have a prostate infection or cancer. They feel pain in the perineum, discomfort while urinating, or a dull ache in the testicles. But when the doctor runs the tests, The urine is clean and the prostate is normal size. The issue isn't the gland, it's the exhausted, cramped muscles surrounding it. In this scenario, the daily habit is causing physical trauma to the pelvic floor. Then, there is the issue of prostate congestion. While we discussed stagnation earlier, congestion is slightly different. During arousal, blood flow to the prostate increases dramatically and the gland swells as it prepares for secretion. If you frequently stimulate the prostate but delay ejaculation for long periods, or if you stimulate it so frequently that the inflammation from the previous session hasn't subsided, the gland can become tender and swollen. This results in a heavy, aching sensation in the pelvis. Paradoxically, by trying to clear the pipes too aggressively, some men induce an inflammatory response simply through mechanical overuse. We must also respect the refractory period. After ejaculation, the body releases prolactin, a hormone that naturally suppresses libido and induces lethargy. This is the body's way of signaling a need for recovery. If you are masturbating daily, not out of physical desire, but out of boredom, stress relief, or compulsion, you are often forcing the body to perform against its hormonal tide. Overriding this natural refractory period repeatedly can lead to desensitization. This isn't just about the brain, it's about the nerves. The death grip syndrome, where a man becomes accustomed to the high pressure of his own hand and loses sensitivity to gentler sensations, is a very real urological complaint. So, while the 21 times a month statistic is a great guideline for long-term risk reduction, it should not be treated as a quota that must be met regardless of how your body feels. If you are experiencing pain during ejaculation, urinary hesitation, or pelvic discomfort, your daily habit may be doing more harm than good. Beyond the physical structure of the prostate, there is a massive amount of anxiety surrounding the biochemical cost of daily masturbation. If you browse men's health forums, you will inevitably find the theory that expelling semen every day drains your body of vital essence, specifically targeting your zinc levels and your testosterone. Let's look at the chemistry to separate the internet folklore from the physiology. It is true that the prostate gland contains the highest concentration of zinc of any soft tissue in the male body. Zinc is essential for the integrity of sperm DNA and for fighting off bacteria within the gland. Because of this, your seminal fluid does contain a significant amount of zinc relative to other body fluids. The theory goes that if you ejaculate daily, you are depleting this mineral faster than you can replace it, leading to fatigue, brain fog, and a weakened immune system. However, when we look at the nutritional numbers, this fear is largely exaggerated for the average man. An average ejaculation releases a few milligrams of zinc. The recommended daily intake for men is around 11 milligrams. Unless you are suffering from severe malnutrition or have a diet completely void of meat, shellfish, or nuts, your body can easily replenish this loss through a standard meal. The body is incredibly efficient at maintaining homeostasis. You are not wasting away by ejaculating daily, you are simply utilizing a resource that your body is designed to replenish. Then, there is the testosterone question. This is the cornerstone of the NoFap and semen retention movements. The belief is that by abstaining, your testosterone levels will skyrocket, and by releasing, they will crash. Science paints a much more stable picture. There is a famous study from 2003 that is often cited by retention communities. The study found that when men abstained from ejaculation for 7 days, their serum testosterone levels peaked, reaching 145% of their baseline on the 7th day. People read that and think, if I stop, I become superhuman. But they often ignore what happened on day 8. In the study, the levels didn't keep going up. They returned to baseline. The body has a feedback loop that strictly regulates hormone levels. You cannot hack your way to steroid-like levels of testosterone simply by not masturbating. Conversely, does daily masturbation lower your testosterone? Studies generally show that immediately after orgasm, there might be a very slight, temporary fluctuation in hormonal markers, but there is no evidence to suggest that frequent ejaculation permanently lowers your baseline testosterone. In fact, sexual arousal itself, the period leading up to the act, can acutely raise testosterone. The body ramps up production in anticipation of the event. So, if you are avoiding masturbation specifically because you think it will give you a permanent hormonal edge, the data doesn't support that. And if you are terrified that a daily habit is chemically castrating you, you can rest easy. Your testicles and prostate are designed to function continuously. As long as you are eating a balanced diet and sleeping well, the drain is negligible. However, simply not draining your nutrients doesn't mean you are optimizing them. If you feel like your erections have lost that fullness or firmness they had in your 20s, it might not be about frequency. It might be about a specific blockage in your blood flow that standard diets miss. There is a fascinating presentation I recently came across regarding a bizarre, simple purple tonic ritual. It takes about 7 seconds, and thousands of men are using it to naturally unclog the hose and restore rock-hard stiffness without resorting to dangerous pills or pumps. If you want to see exactly how this natural fix works, point your phone's camera at the QR code on the screen right now. I've also pinned the link to that video at the top of the comments section below. It's worth watching if you want to fix the root cause rather than just masking the symptoms. Now, speaking of how our bodies change over time, we have to look at the timeline. One final variable we must account for is the timeline. The impact of daily masturbation changes depending on whether you are 25 or 55. We need to make a clear distinction between prostate cancer and BPH, or benign prostatic hyperplasia. BPH is the non-cancerous enlargement of the prostate that happens to almost all men as they age. It is the reason older men have to wake up 3 times a night to use the bathroom. The gland grows and squeezes the urethra. Does daily masturbation prevent this enlargement? The data here is less consistent than it is for cancer. Some epidemiological studies suggest that total lifelong ejaculation frequency is inversely related to BPH. Essentially, men who were more active throughout their lives had fewer symptoms of enlargement later on. This supports the idea that keeping the gland active prevents the inflammatory processes that contribute to excessive growth. However, for men in their 20s and 30s, the focus is primarily on establishing a preventative baseline. The Harvard data showed that high frequency in early adulthood offered a strong protective effect against cancer decades later. It appears that flushing the ducts while the prostate is young and healthy pays dividends down the road. For men in their 50s and 60s, who may already have some degree of enlargement, the approach must be more intuitive. While frequency is still linked to lower cancer risks, an enlarged prostate is more sensitive. If you already suffer from BPH, forcing a daily habit can sometimes irritate the urethra, which is already under pressure. In this demographic, the goal shifts from high-volume prevention to symptom management and listening to the body's signals regarding inflammation. So, where does this leave us? When we weigh the fear-mongering against the clinical data, the verdict is clear. For the vast majority of men, masturbating every day is not a health risk. It is likely a protective health protocol. The evidence from the Harvard study provides a compelling argument that frequent clearance of the prostate is linked to a significant reduction in cancer risk. The biological mechanism of flushing out carcinogens and preventing stagnation makes physiological sense. You are not draining your life force, you are cleaning the filter. However, the urological perspective is ultimately one of balance. The goal is consistency, not obsession. That 21 times a month figure is a benchmark, not a law. If you are chasing a daily quota and ignoring pelvic pain, muscle tension, or psychological burnout, you are missing the point. The moment this habit causes physical discomfort or distress, it stops being beneficial. Your prostate is an organ that thrives on flow. It is designed to work, to produce, and to expel. It does not benefit from stagnation. I have linked the specific Harvard study and further resources regarding prostate health and pelvic floor management in the description below, so you can dive deeper into the data yourself. Ultimately, listen to your body. Keep the system flushing, watch out for tension, and rest easy knowing that in this case, using the machinery is exactly what keeps it running.